Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have invasive breast carcinoma. Okay, in the invasive breast carcinoma, first we have invasive ductal carcinoma. Okay, in the invasive ductal carcinoma, this invasive ductal carcinoma of the blood of the breast, here there is presence of productive fibrosis is present, which is also called as serous fibrosis is seen, and this will account for almost 80% of breast cancer. Here the patient will present with either macroscopic or microscopic uh, lymph node metastasis, and this microscopic or macroscopic lymph node metastasis is seen in almost 60% of the cases. It usually occurs in perimenopausal or postmenopausal women who are in fifth to sixth decade of life. It is seen, and this invasive breast carcinoma is seen as a solitary mass or firm solitary, it is seen as solitary firm mass.
thank you and thank you for watching.